excited. Like,
Mm,
so excited. You can tell. We have a guest today. Or maybe not really a guest.
maybe a guess.
Okay, a guest. We have a guest today, and I'm interviewing Dr. Simeon at Tegbeshe today. And I feel so elated, as you can see. I know I'm always elated. I know. But today I'm extra elated. We're going to be talking about so many things, but the first thing we'll be talking about today is your experience, Dr. Simeon. Permit me to use Dr. Simeon. Your experience as a psychiatrist in the UK.
It's good to be on your channel today, and
Oh, thank you.
I'm as excited as you are yourself. So, and you've asked a very, very, very big stuff, like my experience. Well, it's been all. It's a mix. Well,
Okay.
I don't want to say it's been good, so to say, right?
Okay.
But again, there's still some aspect that you think maybe it's
Hmm.
better back home than yeah. Well, maybe in
Okay.
the course of this in the course of the interview
We'll talk
we
more
talk
about
more
it.
about that. But so far so good. At least that summarize it all.
Okay, okay. Now it's getting more
Yeah,
interesting.
I
I
know.
love that you've said that it's been good so far, but there's sometimes that you reconsider and you're like, okay, am I in the right place?
Well,
Should I just have stayed back in Nigeria? Or when I'm in Nigeria or in the UK, I can thrive anyway. It sounds like that's what you're saying.
definitely. I think because I used to think that mental health generally is universal. The
Mm-hmm.
only difference is just about the culture of the people, and that's why I think there's an aspect of psychiatry itself that deal with transcultural psychiatry itself. So that shows that the mental the mental health itself understand that cultural background
Of
can
course.
determine presentation and management. So
Exactly. Can you people hear him?
what
These
is
are the
that?
real psychiatrists. See, he's already giving me.
What is
Okay, thank you so much.
right?
Now, a lot of people, let me give a background to this. This is for anybody really, but it's also for people who are trying to make a decision about the next steps.
Yeah.
Should I stay back in my home country? It could be Nigeria, it could be anywhere in the world, really. Or should I go abroad? And both of us have made that decision.
Yeah.
But today it's all about Dr. Simeon and what this decision has meant for him. So I'm going to be asking
Maybe
you.
someday we're gonna turn the table around and then
Oh,
I will be interviewing you and see what your
well.
experience has
Okay.
been.
Yes, I'll be happy to share it. But I just wanted to say that you know how that before we come to the UK or the US or Australia or travel abroad generally, there's always that mindset for most people, not everyone, because truly that is not my own story, and I can't say that's your story. But generally, people feel like, oh, it's greener pastures. I'm going to be rich. I'm going to build houses back home. Blah 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 blah. And when they come, the reality is just a little bit different. So I'm going to be asking you, what were your expectations when you were coming to the UK? Be honest.
Yeah, definitely. For everyone that leave the shore of the country,
Sure.
the primary expectation is that you are going for a greener pasture.
Mm,
And then it now depends on individual what your definition of greener pasture is. Right.
mm,
I think that should be the first thing. So when I was living, yes, I was living for a greener pasture. And the greener pasture for me is where I'm able to work on in that. My expectation
mm,
was because where I practiced before I came,
mm-hmm,
I must give kudos to them because I learned the basis of psychiatry. I
mm.
have patients that are pleasant and all, but it does has its own challenges in terms of management where you have patients you cannot
Treat as you
treat
would.
as you want. So my
Mm.
expectation was that okay, I'm going to a place where I'm not expected to have those hindrances. So that's one expectation.
Okay.
Another expectation was to have more money.
Exactly. I was
I know you
waiting for
want,
that.
yeah,
That was like Dr.
yeah,
Simeon.
to make more money, and
Yeah.
then you want to ask if that expectation was met.
Was it?
Well,
We can tell behind camera. Oh,
so I
okay.
think, but by and large, it was for a greener pasture, and whether it's met or not, we talk
We'll talk
about that.
about it as
Yeah,
time goes on, yes.
yeah.
And I really appreciate your honesty. I appreciate your honesty because a lot of people try not to talk about the money aspect. It's important. But you said
Definitely.
something very pertinent. You said that your expectations can, like, your expectations are all is usually to have greener pastures, but what that means to you personally might differ from
From
to
what
another,
it's
from what it means to another
definitely, yeah,
person.
yeah.
And I really like that it was patient care that was at the
Yeah,
center
that's
of it all for you.
definitely that's the major thing. And
Mm.
then because if I tell you that I have interest in psychiatry even before I enter med school,
Mm-hmm.
will you be surprised? So that's why patient care will be the first thing.
Oh, so you had interest
Yeah,
in.
I remember when I got
Okay.
admission to med school, and my mom and dad was asking me which area will you be a surgeon, and I say psychiatrist.
Oh my god.
But maybe my mom's Kilele. So I knew before I entered med
Oh,
school,
good
and I
for
think
you.
I'm one of the few that when we
Exactly.
are in med school, we keep talking about psychiatry, and we ended up in psychiatry.
Wow, wow,
So
wow.
that's why patient care will be utmost for me.
Oh, that's so good.
Yeah.
Everybody needs a psychiatrist like Dr. Simeon. Oh, that's so good. It's really good to know. So now we've talked about the expectations that you had.
Yeah.
Now let's talk about the reality.
We base the reality on the expectation. At
Okay.
least let me use that approach. Right. So in terms of patient care,
Mm-hmm.
I would say the reality has been met.
Okay, that's good.
Because I'm able to see patient don't have to think whether they're able to afford or not their
I know, right?
medications,
Mm-hmm.
right? Which
Mm-hmm.
is at least against what I used to
Experience.
experience
Hmm.
back then. So at least in that regard,
Okay.
in terms of, I know that's the aspect you want.
No, no, no. I want to hear
Well,
everything.
and then in terms of the fact that I'm able to, family is able to settle in well,
Okay.
which is a reality, and you don't have to think about a lot to do for them.
Exactly.
And the financial aspect, human beings' need is always insatiable.
Insatiable.
So but I think I'm still in a better place
Okay.
in
Okay.
that regard. So expectation is.
Hmm. You're such a politician. You have a way of you have your way with words.
Oh,
You're not
well,
saying it, but
well,
you're telling us a
but
bit.
I think I've given you insight, so you can make do with the information.
All right,
But I
it's
think,
fine.
like I said, overall, so far so
It's
good.
worth it.
Yeah, it's worth
Okay.
the journey. Yeah,
Okay, yes. I'm happy that those two expectations were met to an extent. Maybe not 100%, but
definitely.
at
Yeah,
least to a
yeah.
great extent. Now, we've talked about the expectations, your reality, but the truth is that in every new environment that we find ourselves, there'll always be challenges.
Definitely.
Exactly. And I want you to be as vulnerable as possible.
Mm.
What are some of the challenges that you faced?
So my challenges. I'm a social person.
Okay.
So you can imagine already,
Mm,
because in the UK, everybody is usually busy,
true.
and then like I've got some friends, but
Mm-hmm.
when you are free, your friends are not free.
They're busy.
So I think that's one of the challenges. You're not able to socialize,
Okay.
unlike when I was back home, where at least you know the pattern of your work and you're able to
Exactly.
arrange. So I think that's one.
Mm-hmm.
And two, because here too you don't really have much of family time, in the sense that
Mm,
unlike back home where you have a lot of family events. I think it's still
true.
associated to social events anyway. So,
Yes.
and I can tell like I've mentioned, cultural, I like social psychiatry as well. So I
Mm,
like balancing the social aspect and all.
yeah.
But again, for every challenges, there's always, you can always surmount it. So I've always have other way of balancing that as well. So
Okay. I
I
will not
think
ask.
so. I think that's one of it. And then
Okay.
the other challenges, in terms of the practice,
Okay.
back home there used to be some common mental illness that you deal with.
Mm,
Unlike here, where you have some mental illness that we are not conversant with, and pose some challenges in terms of management
mm-hmm.
and guidelines here, and also, but by and large, like I said, for every challenges is the your ability to really look for the solution. It's what really matters. So,
Okay, that's nice.
surmountable, right?
Yeah. Yes, it's nice. I like that you told us about the practice and then your own personal life. So, in terms of the social part, I can relate. I won't really say I'm sociable, but I miss Owambe. I really want to go to a
In
party and
fact, anytime I just feel sometimes we can just arrange something and say, just come and
we
dance
can.
and eat and
We
then
can. Please
have that
invite
vibe.
me. Invite me.
Don't worry, that's something. When
Yeah.
I make the money aspect,
It's not
then
about
I,
just money now. If you say, let's have this, everybody contributes to certain
okay.
amount, and we can pull up
I didn't
something.
bring my pad, but I'm noting it.
Noted. Okay, that's nice. And then in terms of the patient care as well, I appreciate that there are lots of things that maybe not too many things, but there
Yeah.
are those peculiar cases where you're like, okay, I don't know, I don't know what's going on here.
Yeah.
But thankfully, I think as time goes on, just because we learn very fast and on the job,
Definitely.
I think it's something that we.
And I think the environment, if you give in yourself to learning, I think the practice also is very supportive,
True.
and you're able to really catch up on a lot of stuff that you might not be conversant with before. So
Yeah, that's true because with the help of the multidisciplinary team,
exactly. So yeah,
somehow, even if you don't know something, everybody just contributes their wealth of knowledge and
I think it works
when
better when you also know the basics
you know
anyway.
the
Because if you don't have the basics, then it doesn't give room for you to.
true.
But I think we are well trained back.
I know.
I think,
Dr. Simeon,
yeah,
one day I'm going to dedicate my
yeah,
channel to my teachers.
yeah. So I think we learn well from our teachers and our patients. So
Yeah.
so
Yeah.
we're well groomed.
You're right. Okay. And so we've talked about patient care, about the other little things that a lot of people get worried about.
Okay.
Many people, once you tell them that you're traveling, they feel like, oh, what about the cultural differences? What about the language? What about the accent, the racism, the this, the that? There are so many the this and that people bring up. How have you been able to navigate those things? Or have you experienced them? Maybe that should be the first question.
Well, sometimes you experience some things might be in a subtle way, also that. But one thing that I've always kept, even back home, there's still some form of racism. Okay, we call it racism, but it's ethnicism or tribalism
Oh,
and
that's
all.
true.
So I think it's about mindset.
Mm.
It's about your mindset, positive mindset, irrespective of what is being thrown to you. If you've got the positive mindset, you might not even notice it. So I think by and large, I won't say that there's been some subtle ones that I might not, but like I said, even where I was practicing before, you still have some subtle way of being
Tribalism.
tribalism. So I've not taken anyone to heart. If I do my job, I do my job, get back home,
Exactly.
forget what has happened at work, so as to maintain work-life balance.
Wow. I need you to be my psychiatrist. You're so positive, and I really like that.
Yeah, well, I remember in my team, someone said you're always smiling. I said, well, that's the way of coping. So you have to develop, as psychiatrists, we do know about emotional coping skills or emotional based or situational. Since if I can't change situation, then you change your emotion about it. So I think that's my own coping mechanism, really.
Oh, yeah, it's so good. It's so good. You always know psychiatrists. See him, is already talking about defense mechanisms, coping mechanisms. How would you go through life without psychiatry?
Well, I wonder what people are doing, how they are managing. But again, at least you use what you have to make yourself a better person. So, and I think I'm using that well.
You are certainly, and I feel like I've been so blessed by this session. I don't know, it has just further made me know that I'm still normal to be positive.
Definitely, I think that's the fulcrum to life. Your mindset. If you are positive, even when you are passing through the most difficult experience, you still be able to navigate it. And it go better. That's just
it go better. Oh, that's so good. That's really good. So there are definitely challenges.
Definitely.
There'll be people that would try to undermine your capacity or your capabilities rather.
Especially when you move in newly. I had some situation whereby maybe it was like testing, but with no, it's like, oh, this person knows
The
what he's
sound,
doing. So,
yes.
and that built your reputation. That's why I said, show your basis. If
Mm.
the foundation is
Mm.
shaky,
What can the righteous do?
uh,
Preach. Yes.
so we've got. I don't want to say I've got, but I think the foundation is not so bad.
It's
It's easy to really build on
to
it.
build on it.
Yeah.
Yes. Yes. I think that's very essential. And just focusing on the positives. The
Yeah.
truth is that I always tell people say, oh, there's a lot of racism, there's this. I know, and I'm not turning a blind eye to the possibilities of that happening at the workplace. But the truth is, just in like what you said in Nigeria, if you have someone from another tribe
Yeah.
practicing in a place that is predominantly from a different tribe, even patients will say, "No, I don't want to see that doctor. They won't understand my
Definitely.
language." So
Yeah.
we, there always human beings will always be human
I think it's
beings.
a tough for another day.
Yes,
What went on back home?
yes,
That was also something that also built me
built you.
for this journey. So
Hmm.
sometimes you pass through some experience to
Hmm.
build you up for a
Oh,
greater one. So
you should open a church.
am I a preacher already?
You're preaching. You're
Am I
preaching.
motivating
I'm
you?
feeling motivated and positive. Oh, thank you so much. Thank you for sharing. I know that it's not the whole experience, but I know that
Definitely.
someone watching this right now would feel motivated to come over here if they choose, if that's the path they want to choose.
Well, I'll be happy that I've motivated someone there.
Oh, bless you. Thank you so much. Any final words for us?
Well, I think I must appreciate this opportunity,
Okay.
At least sitting with the one and only Omonti. The E for energy.
Oh my god.
And I think you're also doing well. I
Thank
must
you.
commend you. I've told you before, and I'm still telling you again.
I'm going to cut it from here. It's okay.
So
Thank
I
you.
just wish I think the most important thing is to have that basic. No
Mm.
matter what you do in life,
Mm-hmm.
it might not be psychiatry, but anywhere you find yourself, just understand the basics.
Mm.
Wherever you go, you can always build it up and surmount any obstacle that come your
Mm.
way.
Yeah. Yeah, I think that's very vital. And the fact that one of the things that you mentioned was that it wasn't just to build
Yeah,
maybe financial stability for yourself, it's because you also want to make an impact in the world.
yeah,
So wherever you find yourself, be it here, be it
anywhere.
anywhere else, you
Yeah,
would still pursue that. And I think that's one thing that we all need to keep in mind, right?
definitely.
Thank you so
All
much.
right, thank you for having me. So we do this again.
Yes, we will.